So, welcome everybody to another Beta Change Minisode. I'm Katie, and today I'm here with Edith Mukantwari. I'm so excited to introduce everyone to her for our next edition of our Beta Change Minisodes because Edith is a diabetes advocate from Uganda, and she's been doing some really amazing work through the Africa Diabetes Alliance, which she co-founded. So Edith, welcome to our minisodes. We're so excited to have you.
Yeah.
Would you like to go ahead and introduce yourself a little bit to us?
Yes, I would love that. Hi, everyone. Thank you so much for this opportunity, Katie and team. I am so grateful to be here. Well, I would like to say, first of all, that I am Edith Mukantwari from Uganda. Yes, and I have been a type 1 diabetic for 15 years now. Well, I make 15 years in August this year. So it's been a while. And because I think it was a journey that was filled with so many challenges, so many obstacles, and I didn't know where to turn to get the help I needed. You know, it was very challenging. So we decided with a mentor of mine, we decided to start Africa Diabetes Alliance to be the kind of go-to place in case you need advice, in case you need a way to connect to, I guess, different services, you know, be able to connect, for example, we've helped a number of people in the community who are type 1s connect to the CDIC program, which is, I think it's funded by Novo Nordisk, the pharmaceutical company, and they provide free insulin, they provide free syringes, and a lot of other things. They give you a glucometer, they give you strips. So a lot of people who have struggled to get access to medications and things like that, we've managed to help connect a few to the program so that they can manage to, you know, better improve their management. So, and a lot of them are struggling in the community, struggling to access the different things that they need to be able to take care of themselves. So I think that's one of the things that Africa Diabetes Alliance does. So we go out there, we find people who are struggling, and we help you understand what the condition is, get the support you need, be it online support or peer support. We do have a WhatsApp group where we discuss all kinds of topics. People ask questions, they get the help they need. We have a doctor on the platform who is also a type 1 diabetic, actually, and she does a really good job of explaining things, and she really supports us. Each and every one of us. We have another who's a medical student and is also learning how to, you know, get involved in advocacy and things like that. And he's also been a type 1 for maybe 4 years or 5 years now. And yeah, so we're growing the community, and we're hoping that as we grow, you know, more people will come on board. And, you know, because the bigger the family is, the more support you have, you're able to support each other better. So I think that is one of the biggest things that I love about Africa Diabetes Alliance. We also would love to diversify and have people from all over Africa, you know, join, even Africans in the diaspora, I guess. That would be amazing. So we're hoping that the platform will grow. And yeah, I think that's one of the things that I love about what we do.
And I think that's amazing because it's really hard to start your own organization and to, you know, kind of get people to come together in an organized way. So congratulations on doing that. I know that it's very difficult and a lot of hard work to do. And Edith, I just wanted to tell you, I tried to tag you in our post about this minisode, but I wasn't able to. So it says that we are live on the Beta Change page.
Okay. I don't know my Facebook name. That's not my Facebook name. My Facebook name is very different. So you know, but I can just share that.
Yeah, can you see if you can find it? See if you can find the post. It should be like when you go to the page, it should be one of the first posts on it.
Yes, I have. So I can share it. Share now. Yeah, shared.
Great. I'm glad we found it.
Yes, so it has been shared on my text.
Yeah. Sometimes it can go missing. That's the beauty of being live, is that you know, you never know what's going to happen. Yeah. And sometimes you have to find your own post about being live. So that's really fun. So Edith, you mentioned, you know, why you're passionate about the work that you're doing through Africa Diabetes Alliance. And so I wanted to know, like, can you tell us a little bit about like your personal connection to advocacy and like maybe either how it makes you feel or why you really felt compelled to get involved in this way, which is pretty intense. Like, I know that like sometimes there's different levels of involvement. And so, you know, any of them are fine depending on what people can offer. But I was just curious about what made you want to take on a leadership role and to really bring something like this to your community and to expand it to include voices from all over Africa and all over the world.
That's a really good question. I think the first time, well, this was actually never my idea. It was never my idea, first of all. And when someone mentioned it to me, I was in denial about it. I was like, I can't help people because I'm struggling too, you know? So what can I offer? What exactly do I have to offer? So I was in denial about it for a long time. But then my diabetes got harder to manage. It got extremely difficult and I needed someone to help me and there was no one to help me, you know? So I had to figure out a way to help myself. So that's when I was lucky I stumbled upon Dr. Bernstein's book. I literally stumbled upon it because I was, I think, downloading things online and it was one of the books and it came, like the full book was downloaded. You know how difficult it is to get a book like that for free? It's really tough. So I managed to get the book and I started reading the book and the book helped me see and understand my own condition in a way that it had never been explained to me. So because it did that, it helped me and gave me freedom, you know. I felt trapped in my own body at the time. Beg your pardon?
Oh, so I'm sorry. I was just going to ask you, what were some of the things that you learned? Do you remember any of the anything in particular that you learned from it?
I think, first of all, the good thing about it is in the beginning of the book, they give you personal stories that, you know, people who have gone through, I guess, Dr. Bernstein's program. So they have a number of personal stories that they share. And so many of them resonated with me, you know. People were saying I was afraid to go to sleep because I was afraid I wouldn't wake up the next day because of a severe hypo in the night. I had serious fear to go to sleep. I would stay awake till 4 a.m. just to avoid having to sleep and wake up. And, you know, in case you get a hypo in the night, you're scared, you won't wake up. So I had that fear. I had the anxiety. I had, oh my goodness, it was serious. I was afraid to go out, leave my room, literally, because I was afraid I would probably get a hypo on the road on my way to wherever it is I was going. And I was afraid if that happened and I collapsed on the side of the road, what would become of me? You know, it's not safe. No one knows what's wrong with you. And that's the time when I really wished I could get like a diabetes bracelet, but they didn't exist. So we would basically, a lot of those things really resonated with me. And I remember when I read that book, I cried because for the longest time, I thought no one will ever understand what I go through, you know? No one will ever understand how difficult this is. Because I'd tried, I would tell people and they'd be like, no, you'll be fine, don't worry. You know, they just didn't understand how serious it was. So when I found a book that actually explained all of my feelings and validated them and said, you know what, you're not crazy for feeling like that. It's actually very normal. I cried for 3 days. I would read the stories and cry because there were so many stories and it just really blessed my heart, honestly, and helped me see that, hey, your difficulties are not just in your head, they are real. They are actually real. So I needed that validation, you know.
Is this the book? Is this the name of the book, the one that I just
checked? Yes, it is. Perfect. Yes. So that's the book that turned everything around for me.
Okay. Just so people can look it up for themselves, you know, maybe they're interested in it.
Yes,
but I love that the sharing stories part really resonated with you because that's something that I think we have in common that we really like is hearing other people's stories. And, you know, I love a good story and I think that everybody has a story that they can share.
That is true.
So I think that's something that I really enjoy talking to other people about. So I'm sorry to interrupt you. Go ahead.
That's okay. So after when I think at the time I read the book, it really transformed my life. And then I also came across a book written by, I hope I don't forget his name. What's his name? He works with Diatribe, and he has a book. A book that's been, I think it's called Bright Spots and Landmines. So I discovered that book as well, and I read it as well. And together, those two books really changed the way I manage my diabetes, and they improved it so much. I wasn't afraid to go to sleep anymore. The severe hypos that I would get in the night stopped. So I'd go to sleep and wake up with a normal blood sugar of like 5.2, and I was not afraid anymore of going to sleep. So those two books really revolutionized my diabetes management. And I knew, unfortunately, that it's very difficult for a doctor, for example, to explain some of these things to you, because I think I believe they know the principles, but because they don't know the emotional baggage that it comes with, they might not emphasize it as much, It will give us information, but it's not exactly emphasized. So I needed someone to emphasize these things for me, and those books did that. And they made it, and they showed me that, hey, you don't have to live with bad blood sugars. You don't have to. It's not a must that you actually have to get hypos. It's not, you can have better management. And that's a thing that no one had ever told me. No one had sugar management. So I found that really transformational. And from that moment on, I realized, you know what, Edith, you can't sit on this information. You can't. There's so many people struggling just like you, and they need the same information. So at the time, I started the WhatsApp group, so we would share the books. Those who are willing to read them. I know some people read them in like the space of 3 days, and were like, I wish I'd found this book a lot earlier, but thank you so much for sharing it. So I think that's one of the things that we also don't have here as much, access to great books and literature that can help you understand and navigate a lot of these things. So it's important, I think, for us to be able to even use, I guess, also develop our own kind of content and literature that works for this context, because the foods in some of these books are completely different from what we eat here. So we're thinking of actually writing a book that has African content, that has African food, that takes into account that we don't have analog insulins, we have human insulins, and that's what most people use, and that's what they can afford. So we want to be able to write a book that is that actually embodies the context that we live in here in Uganda and in the rest of Africa.
Yeah, I think that's a great idea, Edith. And I think, one of the things that's great about books is that we have so many opportunities to share them. So it can be shared like in print or online. And I know that that's something that's important to you, is being able to make things accessible to people. So I was wondering maybe if you can tell me about some of the different ways you're trying to do that through Africa Diabetes Alliance. I know that you have been doing some in-person work, and maybe that's changed a little bit now. So, maybe that's, if you would like to talk a little bit about how COVID-19 has affected the work that you're doing, and maybe what you're looking to transition into with your operations model.
Yeah. So I think initially we loved the idea of bringing different people living with diabetes together and teaching them about different aspects of management, basically all aspects, but mostly we were focused on food, because that's the information that even doctors don't have. So we figured, people don't actually understand how to navigate food when they're managing diabetes. So we focused mainly on that, on nutrition, on food, on carb counting and things like that. So we would have classes, we'd have people come to the office and sit down and teach and show them how to basically understand what carbohydrates are, how to read food labels and understand how those affect their blood sugar, what nutrients are in the food they're eating. So having people actually realize, it's interesting when you're teaching those classes, initially people don't even think you're going to teach them anything new, right? So they come in and they're like, oh well, it's 1 hour, I have nothing to lose, let me just sit here. But by the time you're done and you're seeing so many light bulbs go off and you're like, oh my goodness, is that true? I can't believe that. What? They are so shocked and they're like, oh my goodness, I really needed this. I didn't know how much I needed this, but I needed it. Mm-hmm. So it's
and I forgot to mention, Edith, that you're a nutritionist. So that's important to you, is that people understand the value of food to them, like, because everyone has like a personal relationship with food, I think. And so anyway, for our audience, I just wanted everybody to know that, you have like a really big passion for helping people understand nutrition and be healthy. So sorry about that.
Thank
Go
you,
ahead.
Katie. Yeah, so we focused on having classes, but the classes cost too much, unfortunately. Sometimes we'd have small classes at the office that would go for maybe 2 hours, usually on Saturdays. And then we would have like really big gatherings, but then you have to feed people, you have to do all these things. So the managing to pull it off was a bit difficult because it would cost a lot of money.
Yeah.
And that stopped us for some time because we couldn't access the money that we needed. So we just decided, you know what, if we can teach people online, let's try to do that. So COVID, I know it was a plan already, but I think implementation took long. And I think COVID pushed us into that place of you have to do it now. You can't run away from it, So we are now in that phase of, okay, we need to figure this out.
Yeah. Congratulations on doing it, though. I mean, it's hard. I think for many of us, this has been something that has changed the landscape of how we do work.
Very true.
So I think a lot of things are going to change probably that we don't even know about yet.
Sure.
So Edith, I was wondering next if you could tell us a little bit about how you navigate, personal boundaries when it comes to advocating. Like if you ever have some advocacy burnout or diabetes burnout that you'd like to share, because I think that it's something that for me gives me a lot of energy, but also like sometimes I need to limit it a little bit because I need to do other things in my life. So sure. I just was wondering if you'd like to share a little bit about what that's like for you.
Advocacy burnout, that was a new term that I actually learned on Twitter this year. Someone posted an article about it and I had never heard about it. Never. But then when I read the article, I was like, okay, I have felt like this, like things are not shifting, like you're trying so hard, like you're pushing so hard, but things are just not moving along the way you would like. So it's been tough, honestly. It's been so tough. Pushing the boundaries because this is new what we're doing. This is not something that has happened, at least not in the NCD space here that we know about. It has happened in HIV. It has happened in, I guess, I think mostly in HIV. So that's the model that a lot of us look up to at the moment. But in NCDs and diabetes in particular, it's really new. No one has been able to do these kinds of things. So we knew that number one, we can't. Advocacy is really important. Advocacy is the way things change. So if you're not willing to speak up, then you're not willing to change anything. If you want to change something, you have to speak up. You have to make noise. If you don't make noise, no one is going to, dream for you that things should be better. They don't know. So you have to inform them. You have to show them how it's done. You have to, tell them what you need. It's not obvious that just because someone is, I guess, in the Ministry of Health, that they understand everything health. It doesn't work like that. So you have to be able to be willing to push the boundaries. If you're not, then advocacy can be really, really, it won't help you. If you're going to wait to be given a platform, sometimes you have to, knock on people's doors, tell them about what you do, why it's important. A lot of the time the push is really, it's a real push. Sometimes someone will listen to you for 2 hours and then go ahead and ignore everything you've just said. but you can't lose it just because, it's not their priority, and you can't blame them. They can't make everyone's problem their priority. So finding ways to push that has really been tough. Being able to keep going even when things look like they are just not changing at all. It's tough, very tough. And the burnout, I've definitely faced that. And it's not just facing burnout in terms of advocacy. Sometimes you face burnout because you're thinking, okay, wait, I am doing all this, I am not getting paid for it, I can barely afford to buy lunch, but I have to keep doing it, because it's important to me, it's important to so many people out there, it's important to the rural girl who doesn't even know that they need this, but you need to keep pushing because, there are newer diagnoses every other day, there are younger children that need someone to look up to, so you keep doing it because it's there's a bigger picture, it's not about you and your hunger and your and your discomfort. It's about something a whole lot bigger, a whole lot more important. So burnout has been real. And I think I reached a point last year where I was like, you know what, Edith, you can't prioritize yourself. If you're going to prioritize yourself, the work will stall. So I kept pushing. I was like, no, do the work. You will take care of yourself afterwards. Unfortunately, that led me into a season where I was so sick. So much sacrifice goes into it, and unfortunately not everyone can see that, but it's important.
So Edith, can you I know that we have a couple minutes left, and I think what you said about advocacy being hard but worth it is so important to what we're doing here all around the world for every advocate. I was just wondering if you can talk about some of the challenges that you're facing in your community with reaching people and with people having access to technologies, even like to view this interview on Facebook, like access to the internet and things that you told me earlier, something that I thought was really powerful, which was like, you don't realize that people don't have access to something that you use every day. So I was wondering if you could just tell us a little bit about that. And I think it will give some advocates who are watching maybe some ideas about ways they can try to solve these problems and how we can keep advocating into the future.
Some of the biggest challenges people living with diabetes are facing here. One of them is access to medication. The good thing is that the Changing Diabetes in Children project started here in, I think, 2009. And it's a project that provides medications and things like that for children, I think below the age of 18. Sometimes they will manage to, if you join the program before you turn 18, then they'll take you on for as long as the project runs, I think. But sometimes they will take you off if you're beyond 25, for example. So I think that really changed things for a lot of us, being able to provide us with free medications, because diabetes is very expensive to manage. So it can be pretty challenging to have to find all that funding to manage, to buy medications, to buy glucometers, to buy strips, to buy all these things. So there are several programs that have come on board trying to solve that problem. Trying to solve a particular challenge, and in our country. I think the CDIC program is currently running in 11 African countries, but there are those countries that don't have it, and I can't even imagine just how difficult it is for them. The other challenge is, once you're not in the CDIC program, unfortunately, then you're going to struggle to get all these things. It's going to be a struggle. I once met a gentleman who told me he had been diagnosed at the age of 26, and he had never heard of the program, but because he didn't know what was going on, he lost his job. He used to work for a bank. He lost his job. He had just been diagnosed maybe a month prior to us meeting, so he was new. He was on medication now, but he struggled to even get the medication he was on. He lost his job. I don't know if he planned on getting, trying to look for a job again, but I know it was a big challenge for him, and he didn't know how to navigate all that. When he joined ADA, I know ADA, Africa Diabetes Alliance, is similar to ADA, American Diabetes Association, so it can be confusing.
That's fine. It's okay.
So it was a big challenge for him to access these things. But when he joined ADA, he managed to get the information he needed. We managed to connect him to the CDIC program, and they were very accepting, I think, because he was already 26, but they said, no, it's okay. We can, it's okay. We can accept you, because he had just finished school. He didn't have a job. So they were like, you know what? You need the help, so we'll help. And a number of people have also been helped in that way. So another big challenge of people, especially of managing diabetes while at school, while you don't have access to medication, can be very complicated. So a lot of people drop out of school. A lot of people fail to get jobs. They can't afford even just food. They can't afford to get they can't afford a house, so they are probably staying with friends, or they are staying with family if they're lucky, and family can still, take care of them. That's one of the biggest challenges. I think socioeconomic matters are serious amongst people living with type 1 diabetes. Unfortunately, if you don't have support in that kind of way, whereby you can afford to even a workplace, for example, having a workplace accept you as a type 1 sometimes can be challenging. I know people who have also lost their jobs just because, people are scared you're going to keep the company back. So they're like, no, we're not hiring you, or, you lose your job. So we've also tried to educate different companies about things like that. We've done type 2 workshops where we've taught people about diet and exercise and things like that as well. And I think it's been really helpful. But of course, if you don't have funding for some of these activities, it's very difficult to sustainably provide them. It's very, very
Funding is
complicated.
such a hard thing. Yeah.
Very hard. Mm-hmm. And people don't get it. People don't know that you're using your personal money, or my mentor actually also really helps out a lot financially. So he sends money a whole lot of the time. If we have a program and you need money to run a program, and you call and tell him, we need money to push this program, he'll send money. And it's his personal money. It's not like organizational money or anything. It's his personal money. If I'm doing different jobs here and there, probably consulting on nutrition for different companies, the pay that I get goes into advocacy. It goes into those kinds of things. So even the money that I earn does not help me. It goes back into the organization. It goes back into training other advocates, because I realize another challenge we have is it's hard to have advocates if they're not trained about how to advocate, So we train them about how to improve their own diabetes. When they do that, we train them about how to, write a story, for example. How do you make it, how do you express or write your story to be able to, get some impact from it? Train them about different things, and while you're training others, you also know you need training for yourself. Because personally, I need training in proposal writing, for example. It's not exactly something I am good at, proposal writing, but everyone tells you, you can't get funding if you're not writing proposals, and you'll sit down to try and write a proposal, but then you don't even know where to take it. You have no idea who is funding all these projects. How can you get their attention? And well, it's honestly been challenging finding the kind of audience. The stories are the best thing, actually, that gets a lot of impact, gets people talking, gets people interested, in what you're doing. So the stories have gone a long way, by the way, a really long way to pushing what we do and pushing, the challenges people are facing. But it's still difficult if people are willing to write stories. But at the end of the day, you also have to keep pushing that same agenda. So someone sends you a story, but if it just stays on the ADA blog, for example, not many people will see it. So I have to go and put it on all my Facebook groups. I have to go and send it to all the people in my, for example, that I know on WhatsApp. I have to email some of it. And, I see a lot of newsletters and stuff. I don't have no idea how to set up a newsletter. No idea. If I knew how to do that, it would save me a lot of stress. But like I said, technology is not, hard. If you don't know how to do these things, they seem simple to a lot of people, but for some of us, if you don't have that kind of training in your background, it's really tough. And self-teaching is also not exactly easy. It takes time, it takes a lot of dedication, and it also requires you to not be stressed wondering where your next meal is coming from. So if you don't know where your next meal is coming from, how are you going to be able to, push all these things? It's really tough. So I think technology goes a long way in I think closing these gaps. It really does. But unfortunately, not everyone has access to the technology that a lot of people use. So I know even if we have a newsletter, chances are high, even now, ADA mostly gets viewers from the West. You would be shocked. But the people who engage with us the most are people from the US, are people from the UK, and yet the Africans are quiet. So you realize that, number one, they are not as active on social media. So even all the posts you're putting up on social media, they're not seeing most of them. All of these things you're putting out there, a big number of them have no idea what's out there. They haven't heard of you. You want to go out there and tell people about all these things, but you can't afford to. It requires transportation. It requires a lot of facilitation. It's very tough, very, very tough. I know there are so many tools we can use online, but unfortunately, a lot of Africans are not very they're not well adapted to technology like that, social media, to email newsletters, things like that. I think you'd manage to get a very small readership from Africa, for example. A big majority would come from the West. And it can be quite challenging. You want your message tailored to Africans, but connecting with the Africans is not as easy, I think we are used to the model of you have to be there physically. Like, for example, if we want to see people, we have to go to a clinic, put up a tent, talk to people in person about what we do, teach them. And we've done that. But unfortunately, most of them would want you now. In addition to that, they will still not contact you. They will still not look for you on Facebook. They'll still not know. You came and found them where they were. You gave them the service, and that was it.
It's not happening. The engagement isn't happening the same online as it is in person.
So I think a lot of people prefer person-to-person communication. But COVID seems to have pushed people into online engagement a bit more. Of course, the access to all these online resources is not the same across the board. There are people who don't have phones, don't have laptops, they don't have internet, they don't have electricity, some of them don't even have food. If they don't have food, they're not going to think about the internet. It's not important, right? So so you have to think about all those different barriers that people are living with. Unfortunately, you have to think about them. And sometimes it's simply not having any idea that it can get better. They feel like, what, I've tried to get better, I have failed to get better, I don't think there is anything better out there. And that mindset is very, very common. You meet people and you have to convince them that it can get better, because after years of trying, everything has failed, and it's very tough to tell them that you can actually get better. It's really tough. They don't accept it just as easily. So you have to show them, you have to insist, you have to continue to push them, check this out, read up on this. There's this term, have you heard of it? So it's a lot of, like you said, you reach out a lot to people. And I've also learned that, unfortunately, it's very, very rare for someone to reach out to us. We usually have to reach out to them. But some people will reach out, and we've met maybe 4 or 5 people who have reached out on our online platforms and gotten the support and help they needed. So I think the future is, things are changing quite drastically thanks to COVID. So using this COVID time to push that kind of engagement is really, really important.
I think that's really great, Edith. I think it's important to frame it that way, because I think also that is like a way to look at the situation in a hopeful way, maybe. Because it's like making us be more innovative. So Edith, I think my last question for you is, we talked about like why sharing stories are important to us and why we like stories, and why, you know, it's important to have people from your own community share stories and then have people from your own community receive them. So I was wondering if you could tell us why you felt it was important to why it's important to have a platform like this in your area, and because you were telling me that for more of the global kind of organizations that are sharing stories around the world, like they're not focusing on people from Uganda or people from Africa and for that matter. So I was wondering why that was important to you, and maybe if you've heard from anybody in the community about why having a platform like yours where they can share stories is important to them.
Well, I think when I started online, I think I was on Instagram a long time ago, I think from probably 2012, but I was never active. And then when I became active again on Instagram, that was 2015. And then I realized, hey, there are type 1s on Instagram that actually are pretty vocal advocates. So I followed a number of them and I learned a lot. I learned a lot from them. By the way, the resources online, even just the different advocates that are on Instagram or Facebook or YouTube, they are doing an amazing, amazing job. You know, they gave me so much hope. They showed me, hey, you know, things get better. And that message is very important. And I realized that, number one, a lot of the stories that I was looking at were stories from the West. They were never stories from Africa. So I thought, you know what, stories are really important, you know. So and I didn't want to just share my story, because most of the times if we went for like a conference, I shared my story a couple of times and you get tired of sharing your story. Like, no, we need new stories. So I was like, no, we need a more diverse set of input. You know, everyone has a different story. Not everyone's story is the same as mine. When I realized that, I was like, you know what? And I think that's the one thing that I wasn't aware of. Not all of us, like we all, even if we all have diabetes, all of us have different challenges. We manage it differently. We have different resources, we have different challenges, we have different barriers. So I had to learn that. And when I did, I realized, you know what, it's important to highlight other people's stories. And I've come to learn that through all these different stories, you know, there is commonality, but there are also so many differences. And because we're willing to share everyone's story, people are realizing, hey, so people are speaking up. And when they see their story, they are so proud of themselves. And I love encouraging that feeling. They're like, oh my God, I have something on the internet that's talking about me, right? And you know, it shows you how important your story is as an individual and how much change it can prompt, right? So you find someone wrote a story and they got maybe 10 comments on their story, and they'll get back to you and they're like, Edith, my story got 10 different comments. And you're like, yes, it did. And they are so proud. And
it's a great empowering feeling.
It is. And you know, even going through the process of writing your story and seeing the impact of it, it makes you want to do more of it, you know. So it has been so encouraging, and it makes me so happy seeing more people be willing to learn and, you know, willing to share, because they know they might not see it in the beginning that, hey, this might actually help someone, but when they see that it helps someone, it gives them a whole other sense of, you know, purpose. It gives them a sense of purpose, a sense of, oh my God, my story matters, you know. And that's an important, I think, important message to get across. So more people are willing to share their stories, and I'm really grateful for it, because honestly, I looked for ways to share my story, and Beyond Type 1 did feature my story once, and I was very grateful for it. But I realized a lot of the readership, even then, with the Beyond Type 1, I tried to share the link with so many people that I knew. But most of the people who read it, I'm sure, were not even African.
Mm-hmm.
Yeah, so I think it's important really to have a platform where Africans can also share their stories, and their stories can make so much sense to people, you know?
Yeah.
Yeah. Yeah,
It's important, I think.
it connected a lot of us. It creates community. It also helps grow the community as well, you know, because people are reading the stories, and even someone who's not diabetic, for example, will read it and then understand, hey, this is actually a real problem, you know. It's not something to just gloss over and just move on, you know. So, and then they realize, oh, some people have people in their family that have diabetes, or a lot of people I've met have said to me, oh, when I was in primary school, I had a classmate, and that was in the 80s or in the 70s. I had a classmate who had diabetes, and at the time, no one even knew type 1 diabetes.
What it was, right?
Exactly. Yeah. So when I meet people like that, I'm like, what? Do you want to share their story? Usually they'll say no, because they don't know their story. They just know they had a classmate who had diabetes. But it's always nice that, you know, they realize, hey, I can actually come up and also share about a person I once knew. And then some will tell you, oh, I knew this child when we were kids, but he passed away. And then you're like, oh, wow. Yeah, so I think it's important to have that platform. A lot of people are responding very positively to it. The readership is still low, but I think we can grow it. You know, we're teaching ourselves how to do these things, so I'm sure it will grow.
Yeah, me too. And I think too, Edith, you know, I think you told me earlier that, you know, being able to share stories, like it's part of being an advocate, and, you know, part of speaking up about something that you believe in. So I think that it's a different way to maybe do that, you know, people are starting to think of more as being advocacy, and having a platform for people to speak is as advocacy, and not necessarily like, you know, protesting or something, you know, like it's like it's a way to give people voices. I think that is different than maybe traditionally thought of in the past.
For sure it is, yes. And it makes it very personal, because I realize that like you said, not everyone has the opportunity to share their story. Even if they really want to, it's not obvious that they have the opportunity. But when you create that opportunity and give and show people, hey, you can actually share your story like this, you can actually, you know, and you share these stories with people, people actually get to realize, hey, this is information I did not have before. This is, you know, and people feel seen, you know, through a different person's story. But if it resonates with their own situation, people feel seen. They feel like they matter. They feel like, you know what, I can do this as well. This is not just for the elite few, you know. Even us as, you know, very ordinary people can do that. And a lot of the time, I've realized that everyone's story does matter. And, you know, they'll talk about African food, and they're talking about African stories and African challenges and African insulins, and, you know, they're telling you about the syringes they use. And these stories are amazing, honestly. They really are. And I think the fact that people really do feel like, you know, you're seeing them, you're relating to them, and, you know, you can understand their point of view, I guess, is really important.
Yeah, and Edith, honestly, I could talk to you about this all day long. I just think you are such a dynamic speaker, and I really love the way that you talk about this, and I can tell that it's something that really matters a lot to you. And so I really thank you so much for sharing with us. I know that this could be construed as like you sharing your story again, but really, I think, I hope you don't feel that way in a negative way, you know. But I think it's the work that you're doing to empower others. I really think is inspiring, and I hope that you would love to come back and join us for another Minisode, because I would love to talk to you about this more. And I just think it's so exciting to hear about the work that you're doing.
Well, thank you.
Really be able to share it with more people, hopefully, and you know, more people to be interested in, in what you're doing and hopefully want to share their stories too.
Yeah, well, thank you so much. Those are too many compliments in one statement, but I'm very grateful.
No, not too many, not enough, not enough.
But I am so grateful that you reached out to, I do love spreading awareness of some of these things, of these issues, of these opportunities, because honestly, in every challenge, there is an opportunity. And I think while currently we have so many challenges to deal with, I think that also presents so many opportunities for us to do so much. So I think just being able to sit down with you and just see how, just as we're talking, and even just from I think we talked before the live started, I realized that I'm actually coming up with so many ideas just talking to you. So
yay! That makes me so happy. I think that's great.
So this has been amazing.
Oh, thank you. I was going to say my teammate, Ashley, who's another co-founder of Beta Change, she's been watching. So she thanks you very much for sharing.
Thank you, Ashley.
So, she's in Australia, so it's really late for her right now. So thank you for staying awake. We appreciate it.
Thank you, Ashley.
But Edith, I hope that you can come back and join us again. I really think that
I would love to. Hopefully we'll have figured out how to do all these different things we've talked about.
Exactly. And we'll hopefully be able to maybe brainstorm more and get some more ideas then.
For sure. Thank you so much. Yeah. Thank you so much.
Thanks everybody for joining us. And please feel free to reach out on our comments on the video if you have any other questions for Edith. And also don't forget to find us on YouTube on our YouTube page. We're also going to tweet it on Twitter. So we'll make sure that we mention the Africa Diabetes Alliance as well.
Thank you.
And we hope that you can reach out to either of us and, find out more about advocacy if that's what you're interested in, or if you're interested in sharing your stories.
Yeah.
So,
Thank you for joining us, guys.